We're live. What's going on, Cigar? What's going on, guys? Cigar, what's happening? Judson, thanks for liking it. You're the only one who liked it, Judson. Thanks. Appreciate it. Saturno. Saturno, is this your first time here? Saturno, two questions. One, is this your first time here? Because I don't recognize your name. And then number two, are you a chick because you used three Y's for the hey? That's my second question. Fake. Faiq. Is that how you say your name? Fake? Fake Aftab. What's going on? What's going on, Yusuf? Ali Harvey, we're right off to the fucking races now, aren't we? This just straight out of the gates with you wanted to get your question across. That's what it was, huh? Haida, could you explain the pneumococcal vaccine guidelines for 2CK? It's confusing. Well, they've shifted, right? So apparently there's a PCV 20 that you can just give straight up at age 65. So PCV 20, or you can give PCV 15 followed by PPSV 23 at least 8 weeks later. Apparently, those are the new guidelines. It's all prior to that, though. It had always been PCV 13 at age 65, followed by PPSV 6 to 12 months later. That's the annoying thing about guidelines is they shift. And pneumococcal, obviously, for high risk groups, right? Like asplenia, sickle cell, right? Cochlear implant, holy shit. That shows up in resources a lot. Cochlear implant. I don't think I've ever fucking seen that assessed once. But it's just like universally / ubiquitously like in resources, like as if it matters. I think I've probably even mentioned it in my resources while we're at it, even though I'm like bashing on it. The chat, good day, bro. What's going on? Yusef, just watch Oppenheimer. What is the deal with that? Like, what people are like mentioning that a lot. Let's see. Always been a lover of your videos, says FAIQ. Aortic regurg, you liked it too. Thanks. Just letting some other people know that we're live. Live. Karen, what's going on? Karen Blair. Good to see you. It's been a while since you've been in our live stream here. Cigar Patel. Yeah, guys, give the video a like if you're coming to the live stream. My Y prime. How to improve matching strongest elements. If you're talking about matching, then it's just 2CK in your class rank. Does that need more explanation? FAIQ, I got your videos as gate of USMLE. Iguahaja, what's going on? Aisha, what's happening? 2CK on the 25th, as in literally in like 2 days. Any advice how to keep myself calm and what to do in these 1.5 days? Yeah, the answer is tomorrow, the day before your exam, you should have a very chill / light day. I don't want you studying past, if you choose to study tomorrow, which it's not mandatory, I don't want you studying past like 2 p.m., 3 p.m. I don't think you need to study the day before. If your knowledge is so tenuous that you believe that studying the day before is going to make or break, it means you're really not ready. So tomorrow you need to just have a chill day and have dinner with friends and family, watch a movie, go to the gym, like have a chill day tomorrow. I don't want it to be a 14, 15-hour study day tonight. Okay. I don't want that. Quadruple two. Students get hysterical, absolute nonsense. Okay. I mean, I know you're joking because I say that a lot in my clips. Ahmed, what's going on? Angela, what's going on? You have a red heart today. Appreciate it. No, and Noain, Noayn. Hey, Melman, NBMEs are fluctuating. 240, 218, 244, 270, 254, 240, 253, 252. Examine 7 days. Am I ready for 260 plus? Yes, but don't be disappointed if you get in the 240s or 218. The worst thing that can happen is you get a score like a 270. I don't know what happened with your scores. 218, 270. There's something wrong with that. There's something wrong with your scores there. Yeah, I've never seen a student get a 218 and a 270 like that. I've never seen that because a 218 means you know nothing because it passed a 214. So a 218 means you know like jack shit and you're getting easy questions wrong. And then a 270 means you're acing it. So maybe NBME 10 was actually the fluke. Like maybe I don't know, did you see it prior or something? Regardless, if you have only 7 days, I just want it to be where you're finishing your NBME review. Bobby Swade, NBME 31. Is that the most predictive NBME? They're all the same. If it's an MCQ and we're going to choose which NBME form is most predictive, well, why don't we just logically choose the latest NBME form? But it doesn't fucking matter, okay? You could say NBME 20. It's equally predictive. Vish, I recently started watching your videos and they have been really helpful. Thank you so much. That's cool, Vish. Ali Harvey, Doc, Mike, how to get prepared for the 9 hours, how to build the stamina for it. Exam is August 1st. The answer is you're just going to do it because it's one of those scenarios where when you're actually in the real deal, it's going to be basically the quickest day of your life. Okay. So, I mean, I guess it's step one for you. It'll be the quickest day of your life. You'll be in and out and you'll just realize that the whole day has passed by, like being in a time machine pretty much. You're not going to have any issues when you're actually in the real deal. It's just something with like the human brain that like when it matters and like you're actually in the actual medical licensing exam and you know you can't fuck up, like you're just going to get the job done. FAIQ, why do you always say NBME and USMLE related? Because they are the same. That's why. I mean, how many times do I have to like talk about this where, you guys need to know that the NBME questions, the USMLE questions are exactly the same, right? Not Qbank. The NBMEs are the USMLE. You're going to get repeats from the offline forms on the online forms, and you'll get repeats on the real deal as well. And even the comp exams, the NBME sponsored CBSE comp exams, those questions repeat on the offline online NBME forms as well. And you're going to get students who might come out of the real deal, e.g. on Reddit, and say that they didn't get any repeats or that type of thing. And that's actually subjectively nonsense because, and I know this because I've sent repeats to students before and they won't even realize the repeats. Okay. Like I'll send questions, certain offline questions to students. They'll encounter them on the NBME exams. They might get them wrong. And I'm like, I fucking sent you that question a month ago. They don't remember. And you're not going to remember questions from the NBMEs that didn't give you problems. You're going to be more inclined, it makes sense. You're going to be more inclined to remember questions that gave you problems. Equihaj Noor, how to learn the embryological derivatives. They are remembered one moment and the next forgotten. Well, it's like literally half a page. There's like very, very little embryo you need to know for USMLE. I've talked about this. I would say like, I don't know, maybe at least half your questions, like 65% of your questions are just neural crest as the answer. If you don't know an answer, just choose neural crest, like literally. Like Hirschsprung disease, cardiac defects, DeGeorge syndrome, neural crest, neurofibromas. Okay, just choose neural crest. Obviously, the other components could be, I said that was 65%. Also, third and fourth pharyngeal pouches, right? That's DeGeorge syndrome. And you should just know that the fourth pouch is going to be the superior parathyroids, third pouch, inferior parathyroids, and the thymus, right? So they could give you a parathyroid adenoma. They'll say there's like a superior left parathyroid adenoma, and the answer will be something relating to the fourth pouch, right? So you have to know what the third and the fourth independently, what they are. It's not hard. You just got to know it. And then you have other things like tracheoesophageal fistula. That's endoderm because it's esophagus. You need to know thyroglossal duct cyst. That's going to be endoderm of foramen cecum. That's on the NBME exam. You got to know craniopharyngioma. It's Rathke pouch. They can write that as roof of the primitive oral cavity or oropharynx. Okay. Let's see. The fuck was I? I mean, the chat just moved on me. No idea where I was. Let's see. Pallavi. Hi, Mike. I have my step one in a month, feeling burnout. Any advice you would give? You can take a day off. There's nothing wrong with that. You know, when you're in the midst of like dedicated and you say, no way, I can take a day off. Like, I can't do that. Yeah, you can, because it'll make you more efficient when you're actually resuming study. Don't be lazy, but like you can take a day off. That's totally fine. I did that maybe like 6 weeks before my step one. I took a day off. I went to the beach. I was in Australia at the time. But I was like hyper gunner back in the day, and I didn't want to take a day off, but I did, and it helped. Looking back, like it wasn't a big deal. It's like, yes, take a day off. Like I didn't realize, like I thought that was a huge deal, taking a day off. But you got to do that sometimes. Go to the gym daily. I've said do that. That really helps for your psyche. Nav. How can we differentiate between von Willebrand disease, hemophilia A and B on NBME questions? Both have increased PTT. Yeah, it's very basic. It's pass level. I've made lots of questions on that on my YouTube MCQs, like tons of questions on that, right? And it's in my hematology PDF. But von Willebrand disease, autosomal dominant, right? Hemophilia A and B, X-linked recessive. You got to know the inheritance patterns for those. Von Willebrand disease, they tend to give you a girl. They just tend to do that. It's like they reward you for knowing inheritance patterns. Like, could von Willebrand disease be a guy? Obviously, it's autosomal dominant, but they tend to reward you. Where, for example, if they give you a vignette of VWD and they'll give you a 17-year-old girl, you can eliminate hemophilia A and B right away as answer choices. Because if you know your inheritance pattern, you say, well, those are X-linked recessive, you know, you're rewarded. And you say, well, it's clearly not the case here. But von Willebrand disease, you're going to have one platelet problem and one clotting factor problem. That's how like 9 out of 10 questions are going to present. One platelet problem, one clotting factor problem. Platelet problem tends to be epistaxis. That's the favorite on USMLE. It can be mild cutaneous findings, petechiae, ecchymoses, okay, easy bruising. They can say that. Heavy menses can go either toward platelets or clotting factors. It's either or for heavy menses. And excessive bleeding with tooth extraction is clotting factor. Hemarthrosis, bleeding into a knee, into a joint. Although that's clotting factor, it's, to my observation, that's going to be hemophilia, not von Willebrand disease. Okay, so where was, oh yeah, the chat. Where? Okay. But they're going to give you one platelet problem, one clotting factor problem. So for von Willebrand disease, so they can say you've got a 17-year-old girl who she's got nosebleeds and heavy periods, or she has history of nosebleeds and she has history of excessive bleeding with tooth extraction. So that's going to be von Willebrand disease. And you need to know VWD just bridges glycoprotein 1B on platelets to vascular endothelium, right? Underlying collagens, platelet adhesion. And then hemophilia A and B, as we talked about, X-linked recessive, but that will be a school-age boy with bleeding into the knee, or it's going to be excessive bleeding with circumcision in a neonate. Okay, so there's a lot we can talk about on that front, but VWD, you need to know that your platelets are always going to be fucked up because you need that to, as I just said, for platelet adhesion. So bleeding time is always increased. But the secondary role of VWD is stabilizing factor VIII in plasma. It's a mere secondary role. It's not a primary role. It's an ancillary / side role. And for that reason, PTT is not always increased. It's only about half of USMLE questions that PTT is increased in von Willebrand disease. Okay, because it's an ancillary / side role of von Willebrand factor. It's not the primary role. So bleeding time always increased. PTT only increased half the time. Holy shit. Students will get that wrong because they think it has to be increased. No, it doesn't. PT unchanged, but hemophilia, it's going to be an isolated increase in PTT. Iman, I did. Thanks for being a member. Hey, Mike, where can I find UWorld 2023, the entire thing. I don't know, on their fucking website. Not texting, hey Mike, what's up? Adelaram, good to see you. Hello Mike, there have been posts on Reddit about a lot of step one questions on CK exam. What high yield parts of USMLE step one do you think we need to study for CK? What do you think about it? Yeah, that's definitely true. Okay, so there are going to be a lot of step one-esque questions in TCK. Absolutely. And for that reason, I also get annoyed when students like want this dichotomy, this strong distinction in my resources between step one and step two. It's an annoyance about like, are you sure is this step two or step one? And it's like, bro, it's fucking both. Okay, because you get tons of step one-esque questions on 2CK. In particular, as examples, you're asking which could be the immunodeficiency syndromes, exceedingly high yield for pediatrics component. You gotta know the immunodeficiencies. So if you go into my immuno PDF, I have a big table. You have to know those at step one level for 2CK, literally. So you'll get like questions on like, you got to give saline or something, right? Something clinical like NG tube. Okay. And then the next question will be like hyper IgM syndrome. And the answer is CD40 deficiency of CD40 ligand. Okay. So the immunodeficiencies will show up very step one esque with mechanisms. For Wiska-Aldrich syndrome, you need to know T cell is the answer. T cell dysfunction that shows up on 2CK. Okay, so a Wiska-Aldrich syndrome, X-linked recessive, but triad of thrombocytopenia, eczematoid skin lesions, immunodeficiency. So, yeah, I mean, this is also why I've said that you don't want to shortchange your step one prep, right? Because some people just want to get the pass and then move on to 2CK. But it's karmic. Okay, it's to my observation that students who struggle with 2CK materials because they have weak step one foundation, and you're going to get some questions on your real deal that are very step one esque. And if you had shortchanged yourself for step one, you might have greater difficulty. But if you know a lot of weird factoids as well, that can help you sometimes. Hey, Adelia, I'm following your advice and watching a movie the evening before my exam. Any movie recommendations? I've said that the night before my step one, I watched back in 2012. I watched Shawshank Redemption. It's a happy movie. You have to watch something happy, right? Don't watch like something very like don't watch like a horror movie the night before. Like watch something that has like a good, pleasant ending, right? Just have a chill. I just watched that with family and had a couple slices of pizza. I had a chill evening, couple cups of chamomile tea, milk with milk and honey. Just had a chill evening night before my USMLE. That's what you gotta do. Knowing you're right, I did NBME 7 218 when I was sick. I didn't see NBME 10 270 before I took it. Yeah, I mean, being sick isn't an excuse though. So I don't like that. I don't like those scores. I would be more inclined to disregard your 270. That's what I would do. If you're like one of my students, I'd race you through certain content and I would know where you're sitting. I'd be like, yeah, this student's not sitting at 270. Or I'd be like, you're definitely like higher than 218. It could be something like that. But I could gain a sense of where you're sitting. I think my biggest advice is you want to be confident. You want to be optimistic, of course, but don't be delusional. Don't set your expectations too high. You want to have optimistic but humble expectations because your happiness level ultimately is going to be related to, or it's going to be connected to, what was your result in comparison to your expectations. So if you're going in there, you're saying, look, I hope I can get above 240 or something, and you end up getting a 258, you'll be quite happy. But if you're expecting to get a 270, you might be pretty upset at the end. I know this just from like years of teaching. Let's see, HUD, where students will sometimes ace the USMLE, but they had high expectations. Like they may have had an NBME or two that were very high, and that's where they set their expectation at. I've seen that before. Let's see, HUD. What's going on? HUD. Karen. Mike, with the NBME plus UWorld plus AMBOSS combo, is it still worth doing USMLE RX? I've said no. Yeah, Karen, you haven't been in my live streams. I've said that the tetra is going to be AMBOSS or UWorld. They're non-superior to each other. USMLE RX doesn't have a role. Okay. I know I made old videos saying like, yes, USMLE, but those were old videos. Like things get updated, viewpoints get refined and updated. So UWorld are embossed non-superior to each other. I don't see any evidence that USMLE really like puts a lot of time into their Qbank in any regard. Like Amboss is very like annoying in terms of they're very up to date with their marketing and advertisements. They do a lot of campaigns, and although I don't like that from a personal angle, I know it reflects that they are an active Qbank. Like they have an active team and they invest resources, and that to me is evidence that they're actually um, yeah, they're investing, right? I mean, that's important. Whereas USMLE, it's like, do they exist? Like, did they created a Qbank and then just what? Did they like, leave the room? Like, where are they? Like, what are they doing? So it's like I don't really see the evidence that they are like that active. So there's that component, and then also you get people over time doing both Qbanks and get positive feedback. And I don't see UWorld or Ambosses. I don't see either one as superior to the other at this point. I think you can do either Qbank; it's perfectly fine. USMLE could be viewed as a tertiary Qbank. Like you could, in theory, maybe do USMLE if you're in first year med and you want to do like extra questions to get foundation. But like I don't consider that USMLE prep. Anything you do in first year med, I don't see as USMLE prep. That's just like foundation building. Like you could do that. You say, well, if I'm going to do USMLE in first year, why not do like Amboss first and then do like UWorld or something, or UWorld then Amboss? If I'm going to do both of those Qbanks, you could. I'm just giving you an example of when a student could do USMLE, and I don't see it as a big deal. HUD, you're in good shape. Yeah, I am in good shape. Dang, hello, Dr. Mike. Is it okay to space out each NBME every 7 days for step one? The answer is no. You say, since I don't have enough time for a dedicated period before the real deal. No, I don't. That's not ideal. Like if you're in a situation where you're like working during the week and we can only put your NBMEs on the weekends, so be it. I don't like those situations though. Occasionally I have to craft schedules like that for students when they have like, they're literally in like a full-time job or on rotations or something. But ideally you've got a dedicated period where you're doing an NBME every 2 days. That's what I want to see for most of you guys. An NBME every 2 days. Kanye, there's a question on one of the CMS forms for IM that expects you to suss out. Yeah, I'm aware. Hypersensitivity pneumonitis in the setting of hot tub. Oh, okay. You're talking about hot tub use. Well, that's hot tub lung. Yeah, that's a MAI, Mycobacterium avium intracellular. Yeah, and guess what, Kanye? You know what? I talk about that in my PDFs. I've made YouTube questions on that as well. Hot tub lung. It's in my pulmonary PDF. Okay, if you literally open my pulmonary PDF and Control F, search hot tub lung, you're gonna see that in there, and you're gonna be like, "Oh, LOL." Like, didn't realize. It's like, well, I fucking talked about it. So if you do my PDFs, you wouldn't be like WTF now, would you? But there's another question on one of the newer forms, like 13, 14 NBMEs, where hypersensitivity pneumonitis is just straight up the answer, but it's like extremely buzzy. It's like they literally say like a farmer is like walking on a mound of hay, and like he's walking on hay and he has like a fever and like difficulty breathing. It's like, okay, and it's hypersensitivity pneumonitis. Augui music, AUGUI music. What's your advice for someone in the 210s? Those are good scores for step one. For step two, I would ask you, have you done all the clinical mastery series forms? You have to do those forms, right? So, you should have finished UWorld or MBOSS before you sit any of the NBMEs or any of the either of the USMLEs. MBOSS or UWorld, you should finish a Qbank. For 2CK, you're going to do the CMS forms all twice. And I want you doing NBME 6 through 14 and free 120. You have to go through all those forms, right? So have you done my YouTube MCQs? So you're in the 210s. Those are the resources you have to go through. Nassan, hi Mike, any tips on studying physiology? It's called high yield arrows. So that's the high yield physio you need to know. People get bogged down in like very nitpicky physio type of books that can help you for first year med, but don't help increase your score for USMLE. Guys, give video a like if you're in the chat right now. High yield arrows is physiology. Okay, I could have named it high yield physio, but there's a lot of endocrine in there as well. Let's see, Vish. Taking my USMLE step 1, 6 months. Do you have any advice on how to balance covering all the components and each system during these months? 6 months is too long. Maybe you're in class right now and that's why you're sitting in 6 months, but you have to finish Qbank. That's the priority. You just have to get through Qbank, and you should be getting through my PDFs: cardio, pulm, renal, gastro, hematology, derm, neuroanatomy, immuno, biochem. Go through all my PDFs while you're in Qbank. And then ultimately you're going to go through NBMEs 20 through 24, then free 120, and then 25, 31. It should be all in the last month if you have it dedicated. Zainab, hey Mike, thank you for your efforts and time. I graduated in 2018. My class rank was shit. Preparing for step 1 right now. I'm wondering about my class rank. Would that affect the match? Well, you can't have entitlement. Like if you get a good 2CK score, you're fine. But I mean, you can't have entitlement as far as like that you're going to match into, plastics at Yale. Like you can't be delusional. You know what I'm saying? So like you got to have, if you're trying to go into a big name program, you got to have all the boxes ticked. But if you have like otherwise just a good 2CK score and your school grades are mediocre, you can apply broadly and you'll match somewhere. That's what's going to happen. So, and if you get a shitty 2CK, then you have to make sure that you apply into transitional and prelim years as well. That's how people don't match, is if they don't apply into those. So let's say you really want to do derm and your scores are decent. They're not great, but they're like decent. But you think I'm gonna apply to like 120 fucking derm programs, and you don't match or something. Well, what you should have done is put all 120 derm programs there, and then under that you apply to like 100 prelim programs or transitional years, which are 1-year programs. You can match into one of those as a safety. Got to do that. Let's see. Curtis, you're such a Chad bro. Thanks, Curtis. L33. Hello, L33. Abdurazak. Is the EM, emergency medicine, hard to match into? I'm sure it is. You have to have experience. It's just scores. That's all it is. It's just scores. There's objective data online. Like they have, like, if you Google like NRMP match data, like they have it objectively. Like they'll show you updated information in PDF form, graphs, charts of IMGs, American grads, scores where people didn't match, when they did match, 25th percentile, 75th percentile, and you have those in chart format. So it'll be very clear as to what scores you need. It's no one's opinion. The data is actually there objectively. Sacred Scout, hey Doc, you've been. How many times do I have to repeat this? I mean, okay, Sacred Scout. So you're saying, hey Doc, you have been saying often, frequently, that girls just care about looks. That's correct. You say, now I feel that even the reaction on the initial approach is just about looks and nothing else. Am I wrong? You are wrong. So I've said that. I've told you this. If you were to walk up to, let's say, 50 women, maybe 45 of them are going to walk away or deflect you. That's normal. It's not about your looks. Okay. I've said this before, that like literally you could approach a girl, say hi, and then 10 minutes later, put you in a lineup with 6 other dudes and say $10,000 to the girl. $10,000. Who's the dude who just said hi to you? She wouldn't even know because she deflected you without looking at you. I've said women are in an off state most of the time. It's not about you. So when I say that women only care about looks, you say, well, how do you make sense of that? It's because of the small number that you do go on dates with. If they decide to meet up with you again, I've said they don't care about your personality. They don't care about your hobbies. They don't care about your ambitions. They don't care if you're intelligent. It's just about looks. And some people say, Mike, that's very like, nihilistic or black pill or whatever. I mean, I'm just saying like what's true as far as women only care about looks. But when you talk about the initial approach, like saying hi for the first time, It's like the equivalent of someone handing you a flyer on the street. You don't want the flyer handed to you. You don't care who the person is. You're not analyzing them. You just don't want the flyer. And most women are in an off state to conversation when you go to introduce yourself. It's not about you. Don't make that part about your looks. That's where you don't want to misconstrue that point I make. Hey, Ali. Hey, Mike. Is it a must for any form to have a question about Hardy-Weinberg equilibrium? No, it's not a must. Is it? It's all over the NBMEs. You keep getting wrong. Yeah, it's on the NBMEs. I mean, my high yield genetics PDF fucking nails Hardy-Weinberg. Okay, my high yield genetics PDF is harder than the NBME exams. Okay, for the questions, but they love Hardy-Weinberg. They do. For example, they can just say like disease frequency is 1 out of 1,600 in the population, and that's your Q squared. So 1/40 is your Q. You set P equal to 1, and then 1/20 is your carrier frequency, right? That's like the type of thing that you have to be able to do pretty fast. And then you can manipulate it with other questions, other points they throw in there, such as if you have a phenotypically normal patient where his or her sibling has an AR disorder, it's a 2/3 chance he or she's a carrier. That's another factoid you need to know. Sacred Scout, that's right. You retract your fucking message. That's right. That's right. You delete that message. Sacred Scout, would you also? Where was I? That's funny. Would you also agree that if a girl ghosts after an arranged date, that it is 100% about looks only and nothing to do about personality, vibe, inner game? I'm laughing at this because it's like, it is true. I do think that's true. Yes. I've said before, like women don't care about you as a person. It's just appearance. That is correct. Let's see, there's some women who are here who are like, that's not true. We care about it. That's not true. Women only care about looks. Let's see, Bruce Wayne, DC or Marvel? No opinion. Attack on Titan, Naruto, One Piece, Barcelona, Real Madrid. um, People ask me about Messi versus Ronaldo. Like Americans don't really give a fuck about soccer. You're already offended that I called it soccer. You're like, oh, Americans don't really care about soccer though. Let's see, Bruce Wayne, USMLE or PLAB. People are asking about PLAB as well. I teach USMLE. Basel, will watching all your immuno videos be enough for the exam? Um, well, you should go through my immuno PDF as well. So I want you to do my immuno videos, yes, the MCQs, but also make sure uh, you're going to go through my immuno PDF. So that combo, very potent for building up your immuno. I've had quite a few people say that they were terrible at immuno, but after going through my immuno PDF, they're like really strong at immuno now. It's a very fucking strong PDF. I mean, I don't know what to tell you. Tushar, what's going on? Basil, regarding step 1. Tushar. 41 people on live. There's not 41 anymore. 27 likes. Hit the like button, guys, says Tushar. Sacred Scout is back with the dating questions, lol. Ahmed Viper. Hey, I've been using your high yield PDFs. They're awesome. Can you please make an awesome embryo high yield PDF? I just talk about how to study embryo anatomy. Well, anatomy, I have a high yield anatomy MSK rheumatology PDF that's excellent. It's on my free stuff tab. Go to that. But for embryo, I already talked about that at the start of this live stream. I've said you can fit all of embryo on like half a page, but I've put embryo in the high yield repro PDF. I've put the embryo in there, but there's no high yield embryo PDF in isolation because I'm not going to make some bullshit fucking 15-page PDF that's a bunch of low yield stuff that I think is a waste of people's time. Like I'm not going to do that just in principle. That's why I put like the relevant embryo in high yield repro. Hussam, you're the best. Thanks. Renato, do you recommend memorizing old USMLE tests going into the exam? The NBMEs, you mean? Yes, I've said memorize the NBMEs. I've said that. Curtis, do you prefer to be addressed as Dr. Mike? I don't. Uh, if people like mention me, if people like address me in third person as Dr. Mike, like in the chat to someone else, that's like fine. If people like DM me, uh, yeah, I mean, it's like it's distancing. You know what I'm saying? Like it's distancing when you say like, I think Mike is fine. Ankita, what would be the score conversion for MME 31 with 78.5% correct? That's a high score. Um, maybe like 220s. It's a pretty good score. Is 70 plus MMEs good enough to pass easily? Yes. Carlos, do you still think that getting a free 120 with 67% on is safe to pass? Not safe, but acceptable. 67. You just have to go in there and replicate that. That's all you have to do. You got to go in there and like just get a 67% on the real deal. Don't fuck up easy shit. Don't have a bad day. Because if you go in there and get 67 on the USMLE, you'll pass. Just like I don't like 60s because you don't have much of a buffer, right? I like seeing like 68 plus on the NBMEs. 70 is obviously really good. 70 is what I like to see. 67 is just you're fine, but don't fuck up. Okay? Don't make dumb fucking errors. Like check all your math questions, like review your biostats formulae. Don't make dumb mistakes and you'll pass. Because the only way you're gonna fail is if you go from a 67 on your free 120 or NBME down to like a 64 or 63 on the real deal because you got stupid fucking questions wrong where like you fucked up SIADH versus DI or Addison disease versus Con. We don't want that. Dr. Dre. I don't know regarding Chadu on that front. I don't know. I don't think he will. Um, I don't think he will because you have to be able to take a lot of heat. You're asking if Sacred Scout will start his own dating YouTube channel. I think no, because it's like politics. There's certain things you do that you have to understand you're going to get lynched and take a lot of heat. Um, and that can cause complications. So, you just have to recognize that if you choose to go in that direction, that can, I mean, Sacred Scout's very emotional as well. I don't know if he can handle like the heat that would come. It's no problem if you're small. If you're small and nobody knows you, you're pretty much like an anonymous. It's no problem. Where it starts to get complicated is if you actually start to blow up. Like if people start to learn who you are, then it actually creates problems. You can kind of go under the radar, have like a small channel somewhat indefinitely, but if you start to grow, with that is going to come criticism and people lynching you and you not being able to respond. And then you have to start debating, like, what you want to do in terms of privacy and changing things around. Um, Nishad took step 2 CK yesterday. Tons of ethics that are ambiguous, but overall, just memorize the NBMEs. Do that because it's the best. And high yield arrows. What's going on? What's going on, Jinty? Nishad, you say it's straight up 15 arrow questions on step 2. Well, I mean, they'll give you values, right? Like people, when they come out of the real deal and they say, well, if someone remarks, like on Reddit, for example, that high yield arrows going through it's a waste because they only got like 2 arrow questions on the real deal, let there be no fucking confusion whatsoever. That it's not that you're going to go into your real deal and get 50 arrow questions. It's that if they give you a sodium of 128, a potassium of 5.7, and a bicarb of 20 in a stem, that's an arrow question, right? Isn't that an arrow question? Sodium's low, potassium's high, bicarb's low. That would be like Addison disease, right? Like you have to know that. That's an arrow question right there. So people get very literal as far as like, I only had 2 up and down arrow type questions. It's like, well, you need to know lab values. You need to know like calcium's 8.4 to 10.2. So, and right. So if you have a low calcium, that's an arrow question. Let's see. Robert. Hey, Mike, any tips to approach biochem, immunogenetics, micro? Those are have you done my PDFs, biochem, immunogenetics PDFs, Robert? Go to my free stuff tab on my website, do those. Micro, I've got a virology PDF on my website. I have micro PowerPoints on my YouTube. Go through those. Already downloaded your PDFs for these? Well, why are you asking if you already downloaded my PDFs? You know what you need to do then. I have biochem modules as well. You can do those. I have Anki. Dr. Khan, how many hours per day should I study for step one? The answer is 8. I would study 8 hours per day. Sacred Scout, you say, I am just confused. I look attractive as never before. I struggle getting contacts for the past months. First 6 months in Poland were like 1 to 3 girls exchanging easily and little deflection. And then your comment ends. Well, I just told you that that's all about timing and not really contact exchanges are not about male appearance. Like a woman doesn't have to be attracted to you. It doesn't matter. Contact exchanges don't mean anything. They mean zero. They literally mean zero. Like you have to understand. I want to keep this like PG. This can like trigger people if I go too like blunt about certain things. But let's just say like a lot of female behavior toward you means zero in terms of whether she's actually interested or not. But you have to understand that if she rejects contact exchange, it's not about your lack of looks, quote unquote. The same way if she does exchange with you, it's not because she necessarily found you attractive either. Contact exchanges are not reflective of anything. They don't mean anything. Okay. And also, if a girl does not respond to your message, even if you do exchange with her, that doesn't necessarily mean anything either. Okay, obviously there could be instances when she does remember you and she's like, yeah, I remember that guy. I wasn't attracted to him or whatever, and I'm not going to respond. That's fine. That'll happen sometimes. Okay. But most of the time, it's not actually what happens. Most of the time, it's just she's in an off state where she's like, no, I'm not open to like some random dude I'm not open to a random dude right now. She wants social circle, right? You might be more attractive. There's no judgment. You might be more attractive, than some guy maybe she's dating, but it doesn't matter because he's social circle. Whereas you're not. You're just a random dude who said hi to her when she was getting on the train or whatever. I wouldn't read into contact exchanges. These things are waves. These things are, there's going to be flux over time in the macro. You have to understand that. Bro, I mean, do I need to get anecdotal? Sacred Scout, right? Right? Do I have to? Do I have to go into like story time as far as like, my history and stuff? Do I have to go on that on my med stream? But you should know that things occur in waves. Let's see. Angela. Yeah, I'm just trying to do part-time internal medicine and open a chain of med spas, have a family and call it a day, LMAO. I mean, that's good. That's, you got to have your own goals. Okay. I mean, I could insert my opinions into that as far as like, but my opinions don't matter. Right. I've said before, people can do whatever they want to do. People get real triggered in 2023 when you voice any opinion about like relationships, family. People get real like irascible real quickly. I've said there's no freedom of speech, right? But I personally think, women should focus more on family over career. But people can do whatever they want to do. Let's see, David, what's going on? What's happening, David? Ahmed Viper, thank you, David Day. 2 Davids, 2 different. So we have David, then we've got David Daygame. Good to see you, bro. Likewise. David Daygame. I think it's the first time you're in my chat, David Daygame. First time you're here. Did I even let Instagram know? I don't think I told Instagram. Did I? I might be cracked out. I don't think I told Instagram that I'm live. No, I didn't. I'm gonna see if I can tell. I'm gonna tell Instagram. I'm gonna tell Instagram that I'm live right now. If I still have the link saved, I do. Live on YouTube. There, letting Instagram know. Just let them know. Good to see you, bro. Sacred Scout. Well, so much for med discussion, right? Hijack my med stream. Um, you're thinking of offering psychotherapy and doing a psychotherapy channel, daily psych cues, and eventually like $400 for 1 hour of psychotherapy. ChatGPT might take your psychotherapy away, right? You could just literally ask ChatGPT like questions about emotions and relationships and stuff, and you're like, shit, this is actually a pretty decent answer. Holy fuck, right? Ashkan. But you got to you yes, make content around something. That's a good idea. You can play around with it, try different things. Ashkan Riggs, do you have any input for thoughts on Adderall use for step prep studying? Been experiencing bad crashes coming off it, and it feels like it's not sustainable. Yeah, I mean, I've said in general, like being on like substances, like never is a good thing. It can't be hypocritical. Like, I use like caffeine and stuff, but like, um, ideally you're not taking any meds. Sometimes when I have a student who's like hardcore on ADHD meds, I'll tell the student like, look, just maintain your fucking meds, and then after your exam I want you like off the meds, because I don't like people on ADHD meds. I think it's bad, just for your mental functioning overall. But I don't want to have it where your exam's in like 6 weeks and then you go off your ADHD meds now, and then you're like, you're non-functional or dysfunctional for like 2 weeks straight. Can't do any study, bouncing off the walls. So, I mean, in general, it's ideal to wean off of these things if you can. But I just want you to keep the study going. Let's see. Renato. I've been failing my NBMEs and seeing that I'm making dumb errors, but I've been studying for weeks. Any advice on test taking strategies? Um, well, yeah, I said that one of the ways, or two of the ways to make fewer dumb errors on NBME exams, and some of you guys know this already, is number one, don't choose weird sounding shit. Okay, so sometimes the answer really is just asthma, not bronchiolitis obliterans organizing pneumonia or bronchoalveolar carcinoma. Sometimes the answer really is just asthma. And the other strategy, the other tip is, if you don't know an answer and you have an initial gut about a particular answer, do not change your fucking answer. Okay. Only change your answer if you're 100% sure that you like missed something. You're like, oh shit, I didn't see that there was a fever. And then you change your answer. Okay. I mean, but don't let it be where you get a question where you're not sure, like whether it's sickle cell or thalassemia, and you've been kind of like, you thought it was sickle cell, and then you're like kind of hovering over it, and you just don't know, and you change it to thalassemia. Wrong fucking answer. Okay. So if you don't know an answer, don't change your answer. And then number two, don't choose weird sounding answers if you don't know. I've talked about this before. Like there's an example is like a pulmonary question, pulmonary histo question on one of the offline forms, where they show you a ferruginous body for asbestosis. And there's a slide with like some sort of cell there. And they say, which of the following cells initiates pulmonary fibrosis in this case? And the answer is macrophage. And it's like, okay, well, macrophages initiate pulmonary fibrosis. Got it. But students like don't know, right? They're like, I don't know. Like, that's a weird question. Okay. Like, what cell initiates pulmonary fibrosis? And there's other cells there, like Kolchitsky cell, Clara cell. Holy shit. And like students like Kolchitsky cell, wrong fucking answer. Okay. You don't even know what a Kolchitsky cell is. You're choosing Kolchitsky cell. So that's like an example. Like if you don't know, sometimes the answer really is just macrophage, not fucking Clara cell. Okay. Not fucking Kolchitsky cell. Kolchitsky cell is actually the cell that can become small cell bronchogenic carcinoma. They're neuroendocrine cells. They literally secrete like serotonin, but it's not a bronchial, or sorry, it's not a bronchial carcinoid tumor, but they are neuroendocrine cells. Clara cells are known as club cells. They secrete glycosaminoglycans, can play a protective role in the respiratory tree. Y prime. Any good movie suggestions? I recently just started. I said I was watching like golf a lot recently, which I still am, but I've started back on BMX, like X Games BMX type stuff. The past couple days, I'm into that as well. So BMX, not skateboarding yet, but BMX. I'm watching again. Let's see. Sacred Scout. Okay, thanks. You say I have to get negative influence out of my life. What is your advice for cutting out long-term loyal friends who are negative influences to my gut? I mean, look, there's a spectrum. I tend to be more cutthroat in terms of people in my life. I'm not really like the HR human resources type to like sit down at a conference table with you with like our tea and be like, let's discuss our concerns. And I feel you're negative toward me. And like, I'm not like that. I more if I feel there's a negative influence in my life, I just cut the person out. I'll block the person. Just like that's like kind of it. And then it's like, all right, peace. Like that. I'm quick to cut people out. Um, and I mean, my dad's dad was like that as well. There's definitely a DNA component there, but also, I think the more when I say on a spectrum, what you could do if you're talking more longer term relationships, especially when you're talking about family, because you're not. I don't recommend cutting family out. Um, is you can audit the amount which you have interaction with that person. So if it's a negative family member, like a sibling or a parent, you maintain the relationship, but rather than talking to, your sibling 3 times a week, you talk to the sibling maybe, I don't know, once every 2 months or something, right? So you can audit, and so you don't have to cut off people completely, but you can reduce the amount that you're interacting with the person. Maybe have a bit of an abeyance. Okay, so a temporary break, and then come back and maybe you have a communication with that person like a year later or something. You can do that. I tend to just block people. That's like my style. Let's see. You say I'm too friendly and don't want to erase it. Yeah, exactly. You are too friendly. Yeah. Where was I? Prague. Yeah. Yeah. Personally, found like going with your gut helps. You might have seen the content before. And you just Kanye. Just to check after completing the second pass of CMS forms, we do free 120 before proceeding to NBMEs 9 through 14. That is correct. Is it bad to do NBMEs 9 through 14 before free one? That is correct. It is bad to do NBMEs 9 through 14 before free 120. When I say bad, I don't mean that it's actually going to be a crisis or deleterious. Like if you actually already finished the forms, I'm like, it doesn't matter. Okay. But you're just putting Reddit ahead of like logic, because the whole idea, like the questions are the same. So it doesn't matter. The percentages are like the same. It's just free 120. We don't get a 3-digit score out of it. There's no data points as far as 3-digit scores, right? Like that's why I like to see 3-digit scores. Free 120 is just a percentage. It's like, well, I got 82% or whatever. And like, you try to extrapolate that over the NBMEs. You're like, well, NBME 10, I had like an 81%. It was this 3-digit score. So maybe free 120 is this 3-digit score. It doesn't matter. I put free 120. I prioritize it slightly under the latest NBMEs because there's no concrete 3-digit score predictor from it. There are graphs out there, but as I said, it's not a crisis. I just put the online NBMEs after free 120. And if people tell you that the exam was quote unquote more like free 120 than the NBMEs, they're lying. Okay. Because, and I say that somewhat facetiously, it's just the real USMLE is going to look like free 120 if you do it online, not the black and white PDF. The real USMLE is going to look like UWorld, which is the same as free 120, but the questions are exactly the same as the NBME, which is exactly the same as free 120. The questions are all the same. Okay. But the interface, when you do the NBMEs online, they don't look like the real USMLE. The real USMLE will be narrower questions that are longer down the page. So people have this illusion that the real USMLE questions are longer than the NBME, because the NBME, the questions are wider but shorter down the page. The length of the questions are the same questions. Where was I? Where was I? Okay. Kanye. You say you found it interesting how you said genetics plays a large role in being alpha. Half Indian chick. Ah. Yeah. Well, I mean, I said young guys fuck up. I said that, Kanye. I've said young guys fuck up. That's like normal for young dudes. Guys in their 20s, like your 20s as a male are entailed by fucking up a lot with women. That's like normal. That's like if you somehow get through your 20s as a dude and like don't fuck up easy opportunities, like that's like rare. Like your 20s, that's like normal for dudes in their 20s, where like a girl, like she invites you to her place or something and you're like twirling your thumbs and she's like, we could watch a movie or something, and you're just like, okay, and you're sitting there and you're not doing anything, you're just watching a movie. Like that's what young dudes like get into. Like young dudes like fuck up. Um, so but DNA component as far as I'm trying to keep things more like neutral for this live stream here. It's not, I mean, it's a medical live stream ultimately. Um, but there's a DNA component in terms of male ability to generate assertiveness and forwardness and ability to push interactions forward. That's something that can be developed. Sacred Scout. That's funny, Sacred Scout. So Sacred Scout, you say, I believe the only, yeah, what's funny is like you say something like that and like that's not acceptable in 2023. They're just opinions. It's all it is. There's no freedom of speech. There's no freedom of speech. Like, I'm just going to read your opinion. It's just your opinion here. You say, I believe the only real purpose of, you know, the female is to raise kids and be obedient to her male partner and loyal. That's your opinion. It's not my opinion, right? But it's like, you have to like say that, but like you just say an opinion like that, and that's like not okay in 2023, right? So that's like I think that's actually the more important discussion is just opinions. They're just opinions, as far as like what people think a male female relationship should be, and they're just opinions and taken the wrong way, right? The feeling like there's no freedom of speech to just like voice a viewpoint, right? The fact that I have to read your opinion like so carefully as if I'm like reading like, invectives or something. I mean, that's the era we're in right now. Kanye, so it seems like you have a unique mental fortitude to have ostensibly changed your behavior so drastically over the next years and kept it up. Not ostensibly. What do you mean ostensibly? Ostensibly means like a veneer. It means like a facade or a semblance of. I haven't ostensibly changed jack shit. I mean, my personality has evolved drastically. There's nothing ostensible. Yeah, I mean, I think mental fortitude. That's a DNA element. The male's ability to have mental fortitude and not complain. That's a DNA component. David Dagan, we chat on Instagram. First time I open your YouTube live. I am aware. I know we chat on Instagram. There's been quite a few Davids like in my stream lately. There was some David who ended the last stream like criticizing my appearance, but I didn't know if it was you or not. But there's been like I don't know 3 Davids in this live stream. Bassem Zaino, what's up, Mike? Did NBME 20 to 24? You did NBME's 2024. You got all of them. 205, 207. Screenshot your incorrect. Is it possible to take step 1 in 2 weeks? Yes. 205, 210 plus is what I want to see. So if you just maintain those scores, you're good. Prague, yeah, I did UWSA 1 a week ago. I got 64%, but then I got maybe 24 yesterday at 75% correct. Perfect example of what I don't like. I'm super confused as to where I'm struggling. Exactly. I said I don't like when a student does well on the NBMEs but shitty on the UWSA, and now we have to follow up the UWSA with like extra exams. Okay, I've said the real USMLE is the NBMEs, not the UWorld self-assessments. Although the UWorld self-assessments have predictive value, they do. I don't tend to prescribe the UWSAs. If you take a UWSA and you do well on it, it's no problem. Great. just an extra data point. But if you get like a 194, which is a fail, 197 is equivalent pass for step one. Okay, maybe like 65, 66% in that ballpark. So if you take, let's say, UW SA 1 or 2 and you get like a 63, 64%, but your NBMEs were good, then now we've got to follow up on the UWSA because it's a data point we can't ignore. I've likened this to like someone has appendicitis and you just start ordering panels of tests that you didn't need to order, and you see that they have prolactin that's 15 times the upper limit of normal. Now you got to fucking follow it up. Now you got to do pituitary MRI. You got to start following these things up. We say, are they on any drugs that could be increasing the prolactin, right? Like D2 antagonists, right? As an example. But now you got to start following these things up, like pituitary MRI maybe. Whereas like you didn't even need to order the prolactin in the first place. So like when someone has a shitty UWSA 1 or 2, when I didn't even initially prescribe it, we can't ignore the data point now that we have it. So it's like now we have to consider NBMEs 19, 18, earlier forms potentially. I just don't like going in that direction. But if we say, if I remark on the good news, Pragya, your NBMEs are the real USMLE and they don't lie. So if you're getting 75, that's solid. Angela, I agree, Mike. I like old school views about relationships raising kids. Well, I mean, I have to sugarcoat everything. I've articulated this quite a bit, that there's no freedom of speech. Okay. You have to be very careful with how you articulate views when we talk about, male female dynamics in 2023. People take things the wrong way, right? I've said this many times before. You can make comments about, you'd say Russia invading Ukraine was great, or like China suppressing the Uyghurs in Western China is like a good thing and no one will blink an eye. But then you say like, well, I think I find it attractive if a female wants to like raise kids and not focus on career, and people get like triggered. You know what I'm saying? So, but I tend to have traditional views on those things. 8 Shelb. Hey, can you give us tips on how to work and improve weak subjects? I'm doing endocrine now using your PDFs and first aid. Find it's hard to get good scores on New World. Okay, well, I want you to go through my PDFs, yes. So you need to continue through Qbank. Not worry about your scores right now. 40 questions in the morning, 4 blocks of 10, untimed tutor random. Then the afternoons and evenings, you're going to do my PDFs and my YouTube MCQs. And so those afternoons where you're focusing on the PS YouTube MCQs, those in turn are going to build up your scores in UWorld as you go. Ahmed, you said you did step 1 2 days before and felt way better in my way out than NBME exams. Is that normal, or I got lucky? How you feel coming out of the exam doesn't mean shit. Okay. Obviously it's good if you come out feeling happy about things, but like you just got to recognize that how you feel coming out doesn't mean shit. It's uncoupled from how you actually performed. Okay. So if you come out and you're feeling like you failed, you probably didn't. You probably got around where your NBMEs were. George Horney, good to see you again. Michael, brother, how's it going? Good to see you. D. Schleiman, holy shit. Welcome back, D. Schleiman. Good to see you. Sacred Scout. How many hours per day are you being productive and working? I mean, I'm pretty like, you could call this live stream working, right? I'm doing a lot of teaching right now. I'm having a very, very busy month, like teaching. And then I do the YouTube clip. I'm doing these live streams. So right now I could say this is like busier. But in general, I mean, I tend to be a person who works. I have good work ethic. I have excellent work ethic. That's one of my strengths. Let's see, Paul Cianin. On PEDS rotation, have completed all of your 4-pillar approach to shells, plus redid Qs, Anki, still not scoring high enough for honors. Have I simply reached my max potential? You need to do did you say you did the 4 CMS forms? Yeah, you said the tetrad. Well, you gotta know the CMS forms for peds. Do them again. The 8 forms. You gotta know those questions. If you're not scoring high enough for honors, that's what you need to know. Right? Read my PDF on pediatrics again. Jay, what percent correct do you need approximately? And do my PEDS PDF. Sorry, the PEDS MCQ playlist. I know you're talking about, you said you did the 4 pillars, but like, do them again. Jay, what percent correct do you need to approximately to get 240, 250 on CK? 80s. I'd say 80s. Afif, can I do only UWorld without doing NBME? And Jay, by the way, you'll take your number of wrongs from the NBMEs you sit, and you can plug those into 3 to score conversion graphs on Reddit, and you can get those conversions, right? So it doesn't have to be a mystery. Afif, can I do only UWorld without NBME? The answer is no. You need to do the NBMEs. Pragya, when you talk about the latest NBMEs, are you referring to online CBSSA exams or the offline NBMEs? When I say latest NBMEs, I'd be talking about online NBMEs, but I've said that I want you doing 20 through 24, then free 120, then 25, 31 for step 1, and then for TCK 6 through 8, free 120, then 9 through 14. Sacred Scout. You say you wish you were forward all along. I am really forward only now. My dad had hammered into my head for all my life that you have to be very friendly to everyone. He is extremely emotionally labile. Well, you're emotionally labile as well. You're like, I think you're probably the most emotionally labile dude I know. Like, your emotional state's like a female beta princess. It's not. I'm not saying it's a bad thing. I'm saying like you're just like, you're an emotional dude. I mean, maybe some girls like that, right? You'll meet some girl who like she needs that or something. Like she's like, he's really like emotional and into me, and like maybe she wants that. Most women don't want that, right? Christian, is your biochemistry Anki deck the same as your PDF, just an Anki format or something different? It's not the same as the PDF. Uma, hey Mike, what should be the safe 3 to score now to book an exam? I said 205, 210 plus is what I want to see. Study USMLE with me. What's your view on? I don't have a view on that. Sacred Scout, do you think you're asking if I think male forwardness is strongly positively correlated with male masculinity? I've said that the masculinization of the male's behavior is directly correlated with how much rejection he takes. I've said that. I think forwardness is DNA primarily, and that can develop over time for sure. But I don't see, a male can be very masculine and maybe not the most forward. I wouldn't link those as like, I don't see, forwardness is more DNA. But masculinity, as far as masculine behavior, as far as not being an emotional princess, that comes from taking lots of L's. That's about consistent L's. I've said that taking repeated rejection will masculinize the male's behavior. Shu Hadi. Forwardness is also not just DNA, but it's linked to your recent micro volumes. If you've had high recent micro volumes, that's going to make you more non-needy and more pertinacious and pushy. Shubhadeep Saha, hello, sir. It's Shubhadeep from India. Currently, I'm preparing for my postgraduate MD exam. Wanted to know if I could pursue my higher degrees from the US after my MD here in India. I'm sure you can. I mean, I just prep students for USMLE. I'm not an expert on like pursuing higher degrees in the United States after you are doing an Indian degree. David, let's see. David Daygame, you're saying. I'm wondering why in 2023 we have this problem with being canceled. Opinion stating you don't see that on Russian soil. Things are more wild, but in the US and Europe, feminism wokeness taking over. Yeah, I mean, we have to be careful with what we say. Um, but I said in some of my other streams that it's it's not ideal, but it's still superior to like living in China or something. Like there are certain places where like if you were to like live in a certain country and you say like you could live in like Hong Kong and be like, I think people should have rights to voice their views. If they don't like government, if they don't like what the government's doing, I think people should be able to voice that freely. And then you'll actually be like apprehended if you're living there. They'll be like, you violated our sedition laws. There's people right now in jail in Hong Kong who just were like pro democracy. So, like, it could be worse. Like, I think this notion of freedom of speech is very, like, it's romantic. It's romantic. I think eventually this will be solved by the blockchain. The financial freedom we have from the blockchain. Okay. Government can't just come and steal your funds. No military can come and steal your private keys if you know your keys, right? At least we don't think so. But if you have like a hard wallet, government can't come and just take your keys, take your resources. You have your money in a bank, government could just take it. If you have a house, government could just take it, right? You have fine art, gold, government can just take it. But no military, no government can take your crypto. So, I mean, it's similar with blockchain and freedom of speech. Eventually, freedom of speech will be protected by blockchain, which will have positives and negatives. People will say, well, it's a negative if you got people, promoting terrorism or pedophilia or, there's certain things that are, abominable, right? That, it's good that certain things are not on the internet, but then, but you get a lot of people who are just voicing opinions about innocuous stuff that, where there's no freedom of speech. And so eventually, the blockchain will solve that. Where people in China, for example, or North Korea, you can put your intellectual property, your views, and it's protected. Where you don't have some platform that can come and just take your views down, right? Michael Saylor's talked a lot about that, in relation to Bitcoin and blockchain. So it would be nice to be able to state more opinions, just like, bluntly, but correct. We're not in an era where there's freedom of speech. Let's see. So you wonder who benefits from this? Well, can we talk about who benefits from this? There's no freedom of speech, right? Ashkan Riggins, Mag, have you noticed any significant differences in the way med is practiced in Japan compared to the West? Well, I'm not like practicing in actual, like, I'm not a practicing doctor in Japan. But I mean, in terms of propriety, if you were to want to practice here, some people have asked about wanting to practice medicine in Japan. And I said, not only would you have to be deeply fluent in Japanese, pretty much a native, you'd have to be like half native, where one of your parents spoke Japanese to you growing up and you're native. Okay. But you'd have to understand the proprieties as far as the culture is concerned. Franco, hey, I love your content. Took NBME 19 yesterday. Raw score 69%, 183. Took after failing NBME 24 some weeks ago. Should I move back to Qbank? 69% NBME 19 was a 183. I don't think so. That seems too. Maybe do you mean a 59%? 59% could be a 183. But if you failed NBME 24, the 56.6%, yeah, I mean, it sounds like your NBME 19 was a 59%. But either way, those are insufficient. And I would go back to Qbank, yes. Edwin, can I use offline UWorld to study for step 3? You can if you want. Are your PDFs the same for step 1? Obu, Are all your PDFs the same for step 1 and step 2? Are they only for step 1? They're for both steps. Ruben Reyes, what's your rationale for completing UWorld Qbank and reviewing explanations and not making Anki cards for UWorld incorrects, making cards for me? Well, it's because the NBMEs are the real USMLE. That's why you're making Anki. UWorld's not the real USMLE, so you have no business memorizing those questions. You need to memorize the NBME questions because those are the actual USMLE. UWorld's not. And when people make Anki and annotate from UWorld or Amboss heavily, it's my observation they don't make progress to the Qbank. Everything's got to be a fucking Anki card. Everything's got to be an annotation. They don't make progress. So it's the combination of those two things. That is why I don't want you annotating and making Anki from Qbank. People just don't make progress. They're not getting through enough questions. They'll get through like 30 questions, not sufficient. Okay. And also just the Qbank's not the real deal. Focus on a lot of nitpicky stuff that's not on the real exam. Aldil24, how do you maintain good work ethic during tough times? It's DNA. There's certain people who just have like a gear where they always need to like be doing stuff. Like even if you're like, it's very rare that I'm like not doing something. Like even if I'm like on a vacation somewhere, I'm thinking about like what I can do. Like I don't like go somewhere and like do nothing. It's rare for me to like be doing that. Because I'll be like in a destination somewhere, and then it's like, okay, I'll go to this cafe and like, for a little bit and like get some stuff done on my laptop. Like I'm always working. Omega Moonswatch. No opinion on that. I've said women care zero about personality. Sacred Scout, I've said that. Women can find you attractive and still reject you. I think you don't understand that. Like women will, if you're not in social circle, like 2023 is largely, it's becoming more social circle oriented. It's not about judgment, but it's like, yes, you can, a girl can reject you. And then you can see her with a male whom you believe is not as attractive as you are. It doesn't matter. He's social circle. You're not. It's not a personality thing when the male is outside social circle. Within social circle, you could say personality matters, right? But outside social circle, if she doesn't know you, she doesn't care about your personality. But we're talking about you being emotionally labile. Those types of things, they don't facilitate an interaction along with a female. Right? You need to be more non-needy. Right? I've talked about this a lot, and it triggers some people. But it's like, if a girl's telling you that she wants you to show more attention or affection, etc., through text, she's lying. Okay, she wants the opposite. Some women will say that's not true. I would like if a guy shows more interest through text. That's a lie. Women prefer that you're mostly dismissive. Let's see. How do you recommend we study for step 2? Overview of resources and timeline. When to do NBMEs and when to do other. You're like one of these people where your question is so hyper basic and stage 0. Mike, tell me like from the bottom up what I should. It's like I've said that you're going to do a Qbank, which is going to be 4,100 questions for UWorld, 3,700 for Amboss. You have to take you 2 months to do it, and then after you finish that, you're going to do all the CMS forms. So it's going to be 3 weeks, 3 to 3.5 weeks, where you do 2 forms per day. And you're going to get through all 45, 50 forms. And then you're going to do NBME 6 through 8, double pass of all the CMS forms. Free 120, 9 through 14. It's going to take you about 4 months, a little over 4 months. If you're post-grad. If you're on rotations, then obviously things have to be subject specific, where for each rotation, let's say peds, you're going to do the Qbank questions, UWorld or Amboss for peds, Number one. Number two, my PDF and PEDS. Number three, a YouTube playlist for PEDS. And number four, all the CMS forms, the clinical master series forms. You're going to do them twice for each rotation. That's how you're going to move through subject specific while you're on rotations. Kanye, I had no idea. I didn't. I didn't read. I didn't read Rolo or Royo's content. I had looked at some of his blog articles, but it was zero relation at all. Completely zero relation. I don't like absorb other dudes' content. Like I'm aware, I'm like educated as to like that he exists. He's a public figure. Like I've looked at some of his stuff like way back, but like it didn't influence my content because Rolo and I we're completely different as far as I'm aware. Like Rolo is like Royo Tomasi is an expert on like male, female. He's very deep, like PhD deep on like male, female dynamics slash interactions. And you could say, well, I'm very deep on that too, but he's more of like an intellectual, like evolutionary, like he's got like that's his lens. He's very much into like the specifics and the whys, just sort of like from a literature intellectual standpoint. I come from it and from an angle. I come at it from an angle of having uh, thousands upon thousands of approach interactions where I see those interactions and I've learned from those interactions. If I said hi to over 100,000 people, right? I mean, that's that's how I've developed my views and become an expert on certain things and how I understand dynamics. So we're both experts, but in different directions, essentially. It would be a good amalgamation. Um, the difference is he's big, I'm not, in terms of being he's an influencer in that domain. I'm not, because I don't put out content for that domain, right? So you can't. He wouldn't have interest in like chatting with me probably because I'm not an influencer in that domain. Um, that's kind of how it works. Like when you start developing influence, let's see, people reach out to you and you have like 20 subs, and it's like, well, you're not gonna, you got to build up your sub count first. That can be important. Let's see. I mean, I think my content is just as good, so it's revolutionary, but the difference is he's been putting out content for decades consistently, right? I just sort of put out content in bursts and like that was it. Ayesha, can I take beta blocker on the morning of exam to help with anxiety? I wouldn't. I wouldn't take anything that slows you down. Sacred Scout. I do think Bitcoin is the safest investment long term. The price is going to fall again, I think, but we're talking macro, not short term. Macro, yes, it's digital gold as it's been referred to. Bezeled. What do you think about AI causing a disruption in our profession in the near future? I don't know about near future. I said that by 2100, surgeons will be phased out. Humans are not going to be performing surgery, at least in Western countries or in modern countries by 2100. It'll just all be robotics at that point. Same way, like, I talked about this in live streams before, how like elevators used to have a conductor. You walk in and there'd be a dude with a lever bring you up and down the floors. And eventually we're going to have every car will be self-driving, and it'll be like weird that there used to be humans driving cars. Well, it'll be like that with surgery. um, you could make a case for AI taking histories, doing the diagnostic, carrying out the diagnostic prowess, right? You have like all the patient's information, and then you have like a GPT-5, 6, 7 interface that's going to solve the diagnoses, etc. Um, So, I mean, that will obviously integrate its way in into general medicine, like family medicine, internal medicine. But I think that there literally will be no surgeons like in the future. Like surgeons are like a mechanical. You have to recognize, like, realize, like surgeons are just mechanical. Like you say, well, they have insights and people have different, anatomies, and you need to think outside the box. Well, that's what AI will do, but better. So, I mean, it's actual intelligence. It's not just like a robot. It's actual like intelligence, and it will be able to think and lateralize better than you can. So I think surgery is actually like gone by the end of the century. Humans conducting surgery, performing surgery, but I think there'll always be a place for human interaction in healthcare, and that you get patients who they will consent to having the human be the one who takes the history or um, performs their care, knowing that the AI has better outcomes, and they'll still like say, "I want the human." Let's say, but surgery, like when you're going under the knife and you have to have a heart surgery, and like the AI has 4,000% better outcomes and performs the surgery 60% faster, and there's less blood loss, etc. You're going to be having the surgery with the AI. I think it'll be akin to like, having LASIK eye surgery where it's all laser, you have it's robotic. Obviously you have the ophthalmologist who's, using the device, but you're like, no, I don't want someone using a knife to like manually cut into my eye and do the ablation of the cells. I'd prefer the laser, the computer to do it. It's going to be exactly the same when you talk about like heart surgeries, and exactly everything's going to be exactly understood by the AI. Let's say, where was I? Sacred Scout. Just looking at comments. Rami, what's going on? What's going on, Rami? David Daygame, do you know any good medical solution for bad sleep without any downsides? Zolpidem, quetiapine work well, but harmful long term. Um, Bad sleep without any downside. The answer is I wouldn't take meds. You need to have good sleep. Good sleep hygiene is just trying to wake up at the same time and go to bed at the same time every day. That's pretty much what it is. Minimize your caffeine. Like these are all like um, the ideal solutions. Doesn't mean we adhere to them, right? Like we'll drink caffeine or we have abnormal sleep schedules. But if someone's really focusing on sleep, like rather than medicating, I would just try to have good sleep hygiene. As I said, waking up and going to bed same time every day, and trying to wean off any substances like caffeine. Remy, you're asking about systemic vascular resistance, pulmonary vascular resistance, like blood pressure's up. Why don't you look at my high cardio PDF? I have like all that stuff, all the arrows for shock. Ramy, all the arrows are in there, and not well, and high yield arrows PDF. Look at high yield arrows PDF. The arrows are literally in there too. Like control, like search, like cardiogenic shock, hypovolemic shock, septic shock, and I have arrow questions in high yield arrows on that stuff. Sacred Sky, you say it sounds like that our only hope are countries where social media are not as popular. Is that correct? Um, yeah, but I think that it's only going to be a temporary slash band-aid solution, because I think eventually as digitization spreads and you have increased social media use, that eventually you're going to have a maximizing of hypergamy and decreased proclivity for a female to engage with a male outside of her social circle in real life. I think the direction, I think what digitization is doing is essentially it's creating a social circle, comma, 11 out of 10 Chad, comma, or zero trajectory for women. In other words, I think that what we're increasingly seeing is women who are, they're only willing to date men who are in their social circle, as in like they're in class with them. They like, PBL, CBL, best friends, boyfriends, coworker, whatever. They work in the same office. So you have social circle. Number two, he's an 11 out of 10 Tom Brady, Chad CEO, male models, multimillionaire. So she's going to be searching for that. Or 3-0. And that's the direction we're moving in. That's the direction we're moving in because of digitization. Right? So, I mean, it used to be where like, maybe 10 years ago or even, I think even 5 years ago, truthfully, because COVID really like pushed things digital, but it used to be where, there'd be a decent, wholesome dude who'd like introduce himself to a female and she'd be willing to have that be a dating interaction. I'm talking about beyond hookups, right? Like, oh, a female will hook up, let there be no confusion. But like, we're talking about like being willingness to date consistently. And so that's like, it used to be the case where women were more open to those interactions in real life prior to digitization. But now it's more about, maximizing hypergamy. And so when you talk about moving to countries where like social media is not as popular, even if that's the case, things move really quickly. So you go to Honduras or something, you go to like Panama, and not every girl has her head in her smartphone on Instagram all day, and maybe that's going to help with real life interaction, back to the flip phone type era, but that's going to be gone within like 5-10 years anyway. Like we're literally the world's digital now. Franco, no, I'm serious. It was 69%, 61 miss equals 180. That's not true. Then the scale's wrong. Use a different scale for that exam then. No, 69% should not be a 183. Sacred Scatif. My question is, how are you emotionally labile and maximally forward at the same time? I mean, like, that would be like a weird combo. That'd be like a weird combo. Why are you so emotional with chicks? That's what I want to know. I'm like trying to imagine what that's even like being, you're saying being maximally forward, but like you're also like emotionally labile. What the fuck does that mean? Right? You're like, let's watch a movie. I'm going to cry if we don't watch a movie right now. She's like, not today. And you're like, no, let's watch. It has to be today. I'm really upset. Like, I don't understand. What does that mean? Maximally forward, but like emotionally labile. It should not be a problem in your view. I see that as like a problem as a dude. I see it as a problem. But I've said that you could lean into it. Like I've said, if it's difficult for you to like work on that, then you could just lean into it and be hyper emotional princess. You could just be like, you could tell the girl like, I have problems. I'm really emotional. And maybe she like, I don't know, maybe you screen for a chick who like wants that or something. Odin, if I had to do 40 year old questions per day, 1,600. 39 days to your final month dedicated for NBME only. What UWorld Qbank system should I focus more on? I've said untimed tutor randoms, how you're going to go through Qbank. Benoit Sandor, I keep getting CGD, chronic granulomatous disease, X-linked agammaglobulinemia, leukocyte deficiency, confused. Okay, what do you want me to tell you? You want me to like dissect those right now? I mean, my immuno PDF, I have those in chart format. I have all the immunodeficiencies, CGD, right? Myeloperoxidase deficiency, Bruton. I have all those conditions there. Syed Ahmed, good to see you again. Anonymous T, I was wondering if there is a PDF for CMS exams 1 and 2 for IM. So in the Telegram group, you were able to get 3 through 8, but not 1 and 2. You got to search around. Many of them are in the Telegram group. You just gotta like search again because people have like problems searching, but then they're like actually like if I go search, they're like in the group. You wait. You said I'm not gonna do that right now, but they're in the group. I think. You're asking about Bitcoin Sacred Scout. You're saying someone who can invest a few hundred euros per month should simply save up money and buy again when it drops to, let's say, 15,000 euros. First of all, wouldn't it be great if we could all time the market and be billionaires? It doesn't work like that. I'm saying I think that there's another leg down. That's what I've said. I think it could go up. It could go up to like 35 or whatever. I mean, it could go higher. There's not despair. I don't think we've had enough pain in the market yet. I think the way you get pain is people being convinced that the bottom is in. Convinced. You got people like me who are like not convinced. So what happens is you get people like me who like if Bitcoin starts going up 35, 40, 45 and you're like holy shit the bottom is definitely in now. Fuck. And then it tanks. And then we go back down to like 7 or 9 or something. That's how you get despair is it has to pull more money in and people have to lose that money. That's how you get a bottom in the market. People are still bullish like it's 2021. Like that sentiment has never abated. I'm not convinced. Okay. So, you could wait, don't take my advice and wait necessarily till 15,000. You say until it drops 15, maybe it won't. Okay. As I said, I could be wrong and it doesn't have another leg down. Maybe it's like, it's the lowest it'll ever be. We don't know. As I already said, it would be great if we could all be billionaires and time the market perfectly. But I don't think your few hundred euros of monopoly money is really going to like matter. If I had like that amount, I would just like hold on to it. Like if you're going to invest like into Bitcoin, I would like, being able to invest is a luxury. It's a threshold if that you cross. People who are just living paycheck to paycheck are not like they don't invest because they're not able to. It's a privilege. Okay. So if you're just like if you got like a few hundred euros per month or whatever, that doesn't really sound like enough in my view to like I would be like, who cares? Like I feel like quality of life is just improved to like have that few extra 100 euros per month straight up than to be like, I'm gonna put it in Bitcoin and then in like 10 years it'll be you could if you can be very frugal and abstemious with, your expenditures. Um, but I mean it's all relative, right? Raimi, LOL, me wanting to go into surgery, then I taking over by the time I start my career. No, it's not gonna be anytime soon. Not anytime soon. I'm saying by 2100, there's not gonna be humans performing surgery anymore. By 2100, maybe in like some places like Africa, I don't know, but it's like at least in today's modern countries, I think you'll just be purely humans aren't able to develop those technologies quickly enough. I think what's going to happen is AI will be self-recursive, right? So maybe by 2035 or 2040, whenever we hit a threshold where AI can improve itself, AGI is going to be like, well, obviously this is what we have to do. And then AGI is going to be what invents the appropriate robotics to be able to carry out those surgeries if they need to be done that way. I think there's going to be some revolutionary changes where, you know, I think there's going to be some big surprises coming, like knifeless surgery, things that could just be done without surgery. Maybe, you're talking like maybe genetic manipulation or nano robotics, like things that where we might not even need to put a scalpel to the skin or a laser to the skin. It might not even have to happen that way. So, I mean, there's AI is going to solve that. But I think the same way we look back at like old remedies, like, leeches, uh, sucking out blood, phlebotomy is like ridiculous. I think that in the future, it'll be very similar. It'll be like they used to use knives to like scalpels to like cut into people and they used to like suture them back up. Like they didn't have laser technology or they didn't have XYZ. Let's see. I think chemotherapy is going to be viewed that way. Chemotherapy is going to be viewed as insane later this century. Insane. Like to be like, we used to give drugs that like killed you off your normal cells to try to kill the cancer. Like we used to give drugs like cyclophosphamide or like azathioprine that used to just like kill all your normal cells in order to try to kill the cancer. Like there were like in the future, we're gonna have like gene targeted therapies like cancer. You'll have the genetics and the epigenetics of the cancer cell versus your normal cell, and then you'll easily be able to target. Like AI will instantly be able to create proteins or um, molecular targets of some kind, molecular moieties that can target the cancer cells. Um, just select out for that. I mean, chemotherapy is going to be viewed as ridiculous later this century. Let's see. Podin, what's your thought on taking caffeine during exams in relation to jitters? Do you suggest any other mild alternative beverage wise? You have to have a healthy caffeine balance. I would, if it were me and I were doing like the USMLE again, I would be in the habit of having only one caffeinated drink per day max before the real USMLE, like for the couple weeks leading up to the USMLE, and then so that would resensitize me. So where during the real deal, I could have like 2 or 3 drinks and feel it. Okay. Some of you don't drink caffeine. Don't worry about it. But like, there's others here that like you have like 2 coffees, 3 drinks. I mean, you don't feel jack shit. You drink it to feel normal. So it's like if you resensitize to the level of like 1 drink per day, maybe like you have a tea daily. That's it. You limit yourself to that, and you just do your best to focus. The real deal, you could have like half a diet Red Bull after one break, half a diet Red Bull after another break, and then you have like you do that. You have like 2 cans total or something, and you're like on fire. Like you feel like you're on speed or something, right? Like because you're resensitized to more caffeine that way. But I would be caffeinated during the real deal. You want to be on fire mentally during the real deal. Yeah, I disagree with that, David. That always like intrigued me that Royo Tomasi promotes vasectomy. That like intrigues me because I strongly disagree with that. I think that's like crazy. That's crazy. Um, I mean, there's a lot of things I'd want to talk about right now, on my med stream and stuff, but um, I am like the antithesis of that. I think that's a bad decision on the male's end. Let's see. What do you think is a safe percentage to reach at least 240s in the real exam? Um, Remy, Remolina, hey. You've already said hey, Remy. We've talked, right? Pragya, also having a routine right when you wake up or when you sleep really helps with waking up and getting to sleep, staying away from blue light right before you go to sleep. Well, yeah, I mean, I have red light, right? This, see that? Hold on. There you go. See that bright blue light? That's what I turn on sometimes when I wake up. So I don't want to get up and I turn on this bright fucking blue light. I can do that. That's one option. I just use this remote. Clearly it works. Now it's not working. There we go. It's more chill. You haven't read High Arrows yet. You're confused about systemic vascular resistance and the reasoning for when it's low or high. Well, you need to know it's high in both hypovolemic and cardiogenic, right? But vascular resistance is low in septic shock due to TNF alpha. Cardiac output's high in early septic shock. Always select high cardiac output for septic shock in USMLE, but cardiac output's low for cardiogenic hypovolemic. The way you differentiate cardiogenic from hypovolemic is cardiogenic will have increased pulmonary capillary wedge pressure, whereas hypovolemic's low pulmonary capillary wedge pressure. And you get JVD in cardiogenic, whereas you get flattened neck veins in hypovolemic. The notion of like warm extremities versus cold is nonsense. I've seen septic shock questions where they give you cool extremities. You're asking why the vascular resistance is increased in hypovolemic and cardiogenic. Well, in cardiogenic, your heart's not pumping, so you have decreased blood pressure as a result of that. So you're just going to increase peripheral constriction to compensate, aren't you? Um, and then for hypovolemic, it's the same deal. I mean, if you have decreased cardiac output, even though your heart can pump fine, if you have decreased cardiac output, you have to constrict peripherally to compensate. So in both cases, you're constricting peripherally as a compensation for the low blood pressure. I mean, but in septic shock, it's the TNF alpha that's dilating, causing low blood pressure. David, you had a 62%, maybe 19. Your exam's mid-September. You have to do Qbank at least until mid-August, and you have to then see how you're going to do 40 questions per day in Qbank and my PDFs, my YouTube MCQs until mid-August, and then we're going to see how your and we're going to see how your NBME 20 goes. Did you already sit the other NBME? Is that why you said NBME 19? Or were you just doing that to see your to get a predictor early? But I don't want you doing your next NBME until a month before your exam. Let's see. I'm gonna read all these fucking comments right now. Sacred Sky, you say I'm not that emotional. Like I hate talking about my feelings. I guess it's because I never got positive emotions from my parents ever, just rage and negativity, mostly during childhood. Okay. I mean, you're in your 20s, so it's okay to blame your parents for things. I'm just joking. Okay. I mean, I know you're not blaming. But by the time you hit 30, I know you're early 20s, but by the time you hit 30, you have to say, like, I'm very much an adult. Like, I am officially an adult. And you can't blame your parents for shortcomings you have as an adult. You can't, like, when you're in your 20s, you can say, I'm insecure about my appearance, or I'm insecure about my intellect, or I'm insecure about X, or I have like certain issues because of this parent or this sibling. Or when you're in your 20s, you still kind of latch on to things like that. But when you hit 30, like, you're very much an adult and you can't do that anymore. So it sort of has to end at, like, I'm 36, for example, right? And I've said many times in my live streams, I've said, like, I had insecurities growing up about appearance because of negative voices that I received all the time about my appearance from a certain parent. And then I had other, insecurities about intellect because I had another parent who didn't validate me. And I resented my parents in different ways, like through my 20s. I had problems. I had a lot of problems. I mean, we all have problems, right? But like by the time I hit like 30, that was a positive thing, because it was like, well, I'm a fucking adult. There's no like blaming your parents anymore. Besides your exam prep, what is the best to do? Do you also offer residency application interview prep advice? I do, but I stay within my lane for the most part. I mean, if are you asking about like I have chats with students, yes, okay, informally about stuff like that, like students who are paying me as like actual for sessions. I don't do, it's not like an hour session where it's like, today we're doing interview prep. No, I don't do that. But it's more like if I'm teaching a student USMLE, for instance, there can be times when I like coach certain aspects of like, this is what you would do for, this part of your application, etc. I don't doubt that, Sacred Scout, that you're +3 standard deviations when it comes to extroversion and emotional affect, because 99.7th percentile, right? That's 3 standard deviations above. So that means if you take 3 dudes out of 1,000, I would agree that you're in the top 3 for emotional ability. Bezeled, which branch of medicine do you specialize in? How do you feel like doing it everyday basis without getting less passionate? Well, I specialize in USMLE, but you're asking about what you can do on a day-to-day basis without getting less passionate over time. I think what you're going to learn is that whatever you pursue is more about what you can tolerate. Um, it's about gaining fulfillment and being able to tolerate something. That's actually the practical outlook. It's not about like this notion of doing what we're passionate about is a very privileged Western mindset. Okay. It's a very privileged Western mindset. Like maybe one out of like 50,000 people is actually literally like doing exactly what they love. But if you take anything you quote unquote love, it's still going to feel like work if you're making a career out of it. Like if you love chess, let's say, well, if you actually want to make a career out of it, a lot of it's work. You got to sit with like books, you got to sit with like AI and like, come up with move permutations, etc. So there's work. But I think like when we talk about specializing, you're thinking about what you want to go into. That's going to be largely like what you can tolerate. Like people who go, I've said this before, like people who do like radiology or like dermatology, they're not going into skin because they actually have an interest in skin. It's all a facade. Okay. It's just about cash. I've said that, right? It's about lifestyle. It's about cash. Like that's what drives people to do certain specialties. But they'll feign that they have interest or feign that they're supposedly passionate. They'll say, I had a family member with X skin condition. And I knew from a young age that I was passionate about. It's bullshit. Okay. I mean, it's just cash and lifestyle. Because if family medicine paid like as much as derm did, if you had it flipped, you'd have everyone's quote unquote passionate about family medicine all of a sudden. It's about doing what you can tolerate. You say, I can tolerate dealing with skin. I think skin's boring, but I can tolerate it because it's going to pay me like $500,000 a year or whatever. And I can have my house, my car, I can go on trips. I can have my grilled salmon, right? I can have like a good lifestyle, get good clothes for the kids or whatever. So you have like a good lifestyle. And you're like, well, that's a good trade-off. I can tolerate like looking at skin. So that's kind of what it comes down to is like what you can tolerate. Um, I have to go to the gym. Let me see. Just looking at some comments. Sacred Sky, you're saying still, if you invest 100 euros after a few years, it gets to 1,000 euros. That's great. No, I agree with that. But like, if you're the type where you're investing like 100 euros and that's it, it says you don't really have the resources to be like investing. You know what I mean? Like, I've said people live paycheck to paycheck. It's like they don't have the luxury to invest. They don't have the luxury. They don't have. So people in their 20s, it's rare to be able to invest. The fact that you are early 20s, early to mid 20s, and you're like considering investing, it's smart, but it's difficult. Okay. When you're in your 30s and older, your income's going to grow. That's largely, and especially those of you here are going to be doctors, like your income's going to grow. Investments will start to come as part of your lifestyle in your 30s. You're going to go into that more. Um, But I mean, I'm just saying, like, if I remember when I was in my 20s, I remember when I was like, it sounds fucking weird. I'm 36. I'm preaching like I'm fucking that old. I mean, but it's like, I was going to say, I remember when I was your age, ridiculous statement. I don't really want to talk like that. But I remember being fucking like 23, 24, and like, it was like a big deal paying fucking like $29 or whatever it is for Wi-Fi, or, you worry about things like that. So if I had an extra like $100, 100 euros, as you're saying here, that makes a big deal. That's a big difference in terms of just your daily, your day-to-day life. Whereas like, you put that away into investment, you all of a sudden you have to be way more um, abstemious with your lifestyle. You're different. Maybe you're smarter than I am. You know what I'm saying? Because like I wouldn't be investing 100 euros only. I wouldn't be investing 100 euros only. I don't need to talk about the numbers that I invest, but I'm just saying like um, I would just like not even. You could make it a goal because so you don't miss the boat. That's kind of what you can make it. You can say, well, I'm gonna get some Bitcoin now while it's cheaper, even if it means even if I don't have a lot of money, so I don't miss the boat entirely. You can, I guess, do that. Bezeled. And what's the secret of doing great in internal medicine throughout one's career? Like, does it mandate studying many hours every day for many years? Any medical specialty / career requires study. Okay. Interests are going to evolve. So it's not like you might be like an internal medicine, an internist, which means internal medicine doctor. Okay. Not an intern, but internist, an internal medicine doctor. You're still going to, if you specialize in like cardio or pulm, not surgery, and you just, you're still going to have to read. You're going to have to read the new articles that come out, right? New England Journal of Medicine, whatever it is. You're still going to have to educate yourself over time. I think family medicine, something that was appealing to me is because I thought medicine was boring by the end of med school. I liked family medicine the most. I've said this, that had I gone on to like practice, I would have chosen family medicine, which was tempting because I genuinely liked family medicine the most. And I had high USMLE scores. At least at the time, they were like, great or score inflation now, but at the time they were like considered very high. But it's nice to like, have those, have a choice as to where you want to go. But I thought family medicine, another positive thing is, it's not one of those areas where, you have to be an expert in a particular field. You should stay educated that, broadly, like, up-to-date regimens, etc. But if you're like a pulmonologist, you fucking have to know the latest stuff like on a day-to-day basis. Like you have to be educated on that stuff. Patient could ask you like anything on a dime. Just be like, there was a new thing I read or heard in the news, this drug or this XYZ, and you have to know that stuff like constantly if you're specializing, right? But family med, you're kind of eased a little bit. You say like, well, I'm aware that azithromycin is the current treatment for community-acquired pneumonia empirically. Sometimes a levofloxacin, like or fluoroquinolone, but like kind of ends there, right? You have like you fulfill your continued education credits / requirements as and you learn day to day just interacting with patients, but you don't have to worry about like being hyper specific and focused on the newest literature. Because if you are a dermatologist and you don't know everything about derm hardcore, all the newest stuff, it's like doesn't look well upon you. Let's see. Do you think I can make a career switch? I am an Austrian doing thoracic surgery research in the US. However, I decided against going for the cardiothoracic surgery residency match. I wanted to apply for him. That's excellent. No. Yeah, let's see. Do you think a program director would accept a career switch? And now, should I argue transitioning from thoracic surgery? I am. That's an amazing thing. That's an advantage. That's not a disadvantage. Okay, because one, people love people who are open to new things. Okay, the worst thing possible is you stay very you stay very closed off. People like applicants who might say, look, I was doing research in thoracic surgery as you're doing, and I learned that I preferred these elements of psych or whatever it is that you're interested in. You're like, I really liked the interacting with the families, and I liked discussing the in-person things where the psychological health of patients really interested me, and that's how I learned that psych is what I'm interested in. And rather than doing thoracic surgery, I realized I was passionate about psych. That could be a huge advantage for you. You say I am. You say, well, I learned that like I'm not a surgery type and I'm really strong at diagnostic prowess, and that like so having those contrasting perspectives, that can be a benefit. It's okay. Like they're just going to look at your scores. They don't really care. Like you could have literally done derm research and then you apply in a thoracic surgery or something. Like they really don't care like you might imagine. If you're applying into like a top academic institution, okay, when everyone else has checked the boxes on certain things, okay. But if you're applying broadly, you don't have delusion, you don't have entitlement. I could see it as an advantage. I could frame it as an advantage. That you have contrasted perspective. That's helped you learn that your interests and passions maybe lie in another direction. That can be a positive for you, not a negative. Odin, thank you, Mike. Sacred Scout. I always feel a huge crash after caffeine. How do you avoid that crash? By drinking more caffeine. That's how you avoid it. In case you can't tell, I'm like hugely cracked out today. It's because I had a matcha. Like I had a matcha maybe like 20 minutes before I did the live stream. That's like natural caffeine. and I had a tea maybe like, I don't know, like 12 hours earlier, um, that's like little caffeine for me. So I've been like cracked out the entire day. How do I avoid it? I would just how would I feel immensely better is if I had like if I drank anything caffeinated right now, I would feel all of a sudden like bipolar manic. Like I'm so happy. I'd be like, oh wow, like I'm so like happy and energetic. Holy shit. I'd be great. It'd be amazing. But I'm not gonna do it. I'm gonna try to like not have caffeine. I'm gonna try to fight through it. Um, Angela, gym vibes today. Yeah, I'm gonna go. I have to. I have to. Today I'm gonna do upper body. Sacred Scout. Since you're asking about follow updates, Sacred Scout, you're saying you're worried that extracting money will kill the chance of seeing her again. What is your take of this? And also, why do some males get many follow updates and some number? What do you mean? You already know. Like, how many times do I have to repeat the same thing? I've said that when women grant follow updates, it's because the male meets her looks threshold. It's only looks. Like women don't care about personality; they just care about appearance. Some women watching this are like, he's right. Actually, I only care about looks. It's not a parody. Like that's in my view. Okay, some people might disagree, but I think that no, they don't care about other aspects. So if a woman doesn't grant a follow up date, then I think that can often be a repudiation of the male's appearance. But you have to handle it. That's like the counterbalance to it. Okay, is that you don't fucking whine and you don't fucking complain and you don't get sad about these things. That's where like you have to be like, you know, that's where you have to have a bit of a backbone. Um, I mean, but it's not an accident that like looks maxing is becoming more important for men. Um, but you're asking about like extracting money back. I mean, that's more of a principle thing. You're asking about like you go get a coffee with a girl and then she doesn't want to come back with you or something, and then you're like, "Well, give me my $4 back or whatever," and then she gives you the $4 for the coffee, and then um, she's not going to meet up with you again. And you're saying, well, I got my money back, but isn't that going to kill the chance of her meeting up again? Well, she wasn't going to meet up again anyway. You know, she's not going to meet up again anyway. If you're in your 20s, it's more important, I guess. If you're in your 20s and you don't have money, then extracting your $4 back can be like, you see that as kind of important. Um, if you're in your 30s as a dude, it's not a crisis to like spend $4 on a fucking coffee for a chick. Um, but you can do it in principle sometimes. Like if you have an interaction at the table where like you're like, there's no way we're gonna be seeing each other again. You can be like $5 for the coffee right now, kind of thing, right? You can say that, and um, 4 out of 5 times she's not going to put up a fuss. She can think it's rude or whatever, but it doesn't matter. You're not seeing. She's not going to see you again anyway. So what's it matter? Um, but if you felt at least neutral about the interaction, my advice is to not extract your money back if she doesn't come back with you, because correct, like some women might not find that favorable, but in your 20s, when you don't have money, that could be a route you take. Let's see. It's a funny topic. Um, Basil, let's say hypothetically AI comes tomorrow and robs me of my job. What do I do then? As in not find myself. How do I not find myself broke? What additional skills should we acquire now so as to avoid this situation? I don't think it's going to be instantaneous where like people are going to be out of jobs. People are going to evolve. It's going to be the same thing as like renewable energies. It's the same thing. Like people are like worried, like, oh my God, we're not going to have jobs like working coal mines or oil rigs or whatever. It's like, well, there'll be jobs with solar and wind, right? So there'll be jobs with AI. There might be universal basic income as well, but things are just going to shift. That's all. Things are just going to shift. There'll be other jobs. Just reading comments. Um, that's laughable. You're saying that like it's a big deal, Sacred Scout. You're like, my current portfolio is 5 digits already, so not that bad for someone my age. That's like funny. Tushar, did you ever have an Indian girlfriend? Yes. Avo, can I ask if you're a doctor, and if so, how long have you been one? And if that isn't the case, what is your day job? I do USMLE. I just found your channel. I graduated med school. Yes, I'm a doctor, but I do USMLE. People find this like radical. People find this like weird. I get asked this question all the time. Like people find it like strange that like I don't like correct. You can do other things with a medical degree, not just like, you can do things with a law degree that doesn't entail like courtroom law. You can be like a politician if you want. A lot of politicians have law degrees, for example, right? Obama, Hillary, they have law degree, they have JDs from Harvard and Yale, respectively. Like you can do other things with your degrees, rather than just like performing surgery in a windowless room or like sitting in another windowless room with, interviewing patients about the same dumb shit all day. You say, well, how's that different from what you're doing in terms of like you talk about USMLE with answering people's same dumb questions all the time? You're right. But I've also said it's about what you can tolerate. That's really what it comes down to. It's about what you can tolerate. Like I see like answering the same dumb USMLE questions. Like I see USMLE as like more tolerable than like, you know, patient interaction, I guess. I guess that's just how I feel. Avo, you're asking about Sacred Scout's like Minnesota personality test with standard deviations, and you're saying you've never seen that. I took that personality test like years ago in my 20s, and I talked about this in a prior live stream. I was like 2 standard deviations above. I shouldn't say above, but away from the mean in terms of not tolerating authority. That was on that personality test. That was like the outlier marker I had, where it was like I don't like authority, which is true. It makes sense for me. I don't like authority. But he says he's 3 standard deviations away from being emotional. I mean, I don't doubt it. Um, you're asking about making 2K a month in a country. You're saying making 2K a month, 2K euros a month in a country where you can meet women easily versus 20K a month in a country that's highly digitized that makes it harder. Okay, it's apples and oranges, but 20K a month versus 2K a month is a huge fucking difference. That's like, I would say the 20K is way better than the 2K as you're putting it here. Right? I mean, that's like, it's a huge difference. The money does increase your happiness. I've said this. It does. For 2 main reasons. Number one, it allows you to give more. If you have a lot of money that you can give, that feels really good. And this isn't like some cliche fucking politically correct talking point. It means like sometimes you can just like give money to like someone who like a family member or like a friend as a gift, or you can give money in certain situations. And if, and like to you, it's not a big deal, but to them it is. And like that feels good. And you'll say like, I remember when that used to be a big deal to me and it's not now, but that feels good being able to give to people. The other reason it increases happiness is you're not plagued and worried, bogged down with like small bills anymore. Okay, like you don't worry about your internet or your gas or your heat or your water or your rent or your phone bill, or like, you don't worry about those things anymore. You don't think about those things anymore. That's like a freedom. You don't care how much the groceries are. Like that's like a freedom that increases happiness in my view. So 20K a month versus 2K a month. I understand your point though. You're studying for CK. How do you utilize UWorld the best? Should I literally just do questions or take notes? What method do you recommend for UWorld usage? I've said just read, don't take notes. You don't have to do Anki or annotate. Just read the explanations. Untimed tutor random. I said minimum 40 per day, maximum 80 per day. So you can do 40 questions in the morning and 4 blocks of 10 untimed tutor random. And then the afternoon is when you have my PDFs, my YouTube MCQs. Avo, I just blocked you from my channel. See, that's how I operate. I don't know if any of you guys were in this live stream earlier. I know analytics, people come in and out. You're talking about like Sacred Scout. If you're still here now, you know what I'm talking about. Well, someone asked a question, kind of probed about my appearance, and I didn't like that. I've said you have to be able to tolerate, criticisms and stuff, right? I've said that's normal. Like you have to be able to tolerate that. But I talked about earlier in this live stream that like Sacred Scout, you were asking about like people in your sphere who are negative. Like, how do you deal with that? And I said I'm the type where I just like block people. Like that's how I do it. I'm quick. I'm just like blocked. Like I don't really sit down with a fucking cup of tea. Let's have an HR session where I say, you said that, and it kind of like I don't think that was the best thing to say, and like I'm not like that. So I just block this fucking person from my channel, which completely benign. You're probably like perfectly good follower. If you're still here, you're probably perfectly happy follower, and now just create a hater. You know what I'm saying? But like I don't like you have to have some EQ. You have to have some EQ. You know why? Because if you give a fuck about my appearance and anything maybe I've done to my appearance, if that's what you actually truly like give a fuck about, you would have the EQ to maybe send a DM or something. You know what I'm saying? That's kind of, you got to have some like EQ. Like you don't go to like a fucking Thanksgiving dinner table and then you like announce across the table, so and so, let's talk about X, let's talk about your appearance and this and that. That's not what you do. You have to have some EQ, right? You have to have some EQ. So there's certain things I don't like, and then I'm just like, boom, blocked forever. That's it. Done. I don't care. Done. Let's see. You'll just have to create another account. If you're still here, just create I'm not going to unblock your username. You can just create another account later. That's all. And then I'll be able to see your comments because I'm not going to be able to see your comments from here on out. You're saying, Sacred Sky, you say you think it's funny to say that follow-up dates equal looks. Correct. You say because some people I know who never got follow-up dates said they are more attractive than I and never got follow-up dates. Okay. Was that it? To just end there? That was it? I've said, how many times do I have to say this? Like, if a woman doesn't want a follow-up date, it's pretty much always just looks. I mean, that's what I'm saying. I don't know about like you versus someone else. That's not what I'm getting into. I'm just saying in like as a vacuum, like a broad statement. I'm saying that like, it's not going to be because she didn't like your personality or something. Like if you're attractive enough for her, she'll have a second date. Women don't care about personality. They don't. They don't care about personality. I'm not saying it like a negative or like something nihilistic. Like I'm just citing like that's what I think. Propofol. Thoughts on anti-aging? I mean, I said I use vitamin E. I use vitamin E oil on my skin before bed. I've been doing that for 13 years. Ram, you're asking if something's wrong with your audio. Yes, I would say there's something wrong with your audio. Tushar, what has been your experience? What's your views on being friends with exes? I'm not friends with exes. I'm not friends with I don't form friends as I'm not friends with women that way. I mean, do I need to trigger more people? Like how many triggerings do I have to like right? People take things the wrong fucking way. It's very, very, very rare, let's just say, um, to have like a fem if you're a male who um, if you're a male with certain efficacies, it's very rare to have genuine female friends. Like maybe someone from like way back or something. It can happen, but it's like not typical. Like I don't prefer to have just like female friends where it's like I don't have platonic friendships. I'll say like zero. I'll say it's like we're dating or zero. I mean, as I said, do I need to trigger people? Giving is better than receiving. Like the vids peep show him. Money gives power. Money gives freedom. Love. 2K versus 5K. Yeah. Okay. 2K versus 5K. Um, yeah. I mean, I would say in my viewpoint, Sacred Scout, I'd be thinking of it as like making like 15K a month versus 40K a month, um, and having those variables you described. That's how I kind of like think of it. I'm not thinking in like baby fucking terms, 2 versus 5K a month. Austin, your appearance is sexy, boss, and I'm straight, but I'd still like to take you on a date, mailman. I don't think you're straight then. Because you have to say no homo with a statement like that, right? Apart from your surgery PDF, do you recommend any other PDF? I recommend all my PDFs. That's hilarious. That's so wrong. Austin, you say looks don't matter to women, looks only matter to men. That's laughable. That's so laughable. That's laughable. That's like romanticizing. Like I used to romanticize like that. It doesn't matter. Male looks don't matter in terms of. I mean, as I said, certain topics. Well, I mean, certain topics I don't need to talk about in this live stream. Okay, male looks don't matter if you're meeting a female for the first time and you happen to, you know, you have a one-time interaction or something that might happen where your looks don't matter, that you happen to be very forward in that situation, but they do matter in terms of her wanting to go on dates with you. They do matter. It's all they care about. um, you're saying women only care about your clout, friend circle, confidence, personality. It's laughable. Well, friend circle is social circle. That's different. I've talked about social circle versus social circle dating versus non-social circle dating. I've said that greater than 99% of the time, when you see an attractive woman with a male who's not so attractive, and there's no negative judgment, just guys ask this question a lot to me. Okay. 99% of the time, it's because of social circle where she knows him from like PBL, CBL. They sit in fucking class together. They see each other in clinical coaching all the time. They work in the same office. It's from her church. It's her coworkers, friends, brother. There's like some sort of interaction, social circle interaction at play. But I'm saying that, and in that case, the social circle overrides the looks requirement in some cases, in many cases. And then you can say things like, confidence, personality, all that stuff matters. Yes. But I'm saying if it's outside social circle where you're saying hi to a female when she's getting onto the bus, or like, and it's not just a simple deflection. I already likened it to getting handed a flyer on the street, or most of the time, it doesn't matter who you are. She's like, not interested. I don't want to be approached right now. I don't want to talk to anyone right now. That's normal. It's not about your looks. But I'm saying if the small percentage that maybe do strike up a conversation, or you go on a date, or something happens from it, her decision to want to see you after the fact is looks based, and only that, in my view. Like in terms of the influence of male wealth and fame, those things have to be like many standard deviations above. It's not just like a little bit. It's not enough for you to just be like, here's my Lexus, or here's like that's not enough. Like it has to be significantly like above, like 3 standard deviations above. It has to be like, we're, here's my uh, Lamborghini with vertical opening doors. And then you take her back to like your Neptune pool with like a second floor jacuzzi and like bungalow, or I mean like that type of like, large granite, you know, massive granite island in the kitchen. And like, I mean, those things are that's when you start to move the needle. Right. But it's like you can be poor as a male and attractive, and that's the woman prefers that. That's my view. Um, Vitamin E is awesome. Austin. Okay. Why is that weird that you don't have female friends either? Why would that be weird? Just reading comments. Just reading comments. Should you skim through first aid fast? The answer is no. Huh. Still just reading comments. Okay. I should just go to the gym. That's what I'm gonna do. That's what I'm gonna do. Let me go to the gym. All right. I'm gonna go to the gym. Guys, I'll do another live stream. You know the deal. This one's been very lengthy. Okay. That's what I'm gonna do. Thanks for coming through. Give the video a like. Give the live stream a like. All right, guys. You know what's really weird? How embarrassing is that? Guys, I didn't end the live stream. Like I thought I ended the live stream. How's that? You know what? Because that just happened, I'm gonna not end the live stream. I'm gonna address like one more question. Like I thought I hit the end button, and that's like awkward, dot dot dot, awkward. Right? I thought I ended the fucking live stream. I didn't. Yeah, I thought I did. I thought I ended it. I did my little pose, right? I did my little pose and I thought I ended it. I didn't. You used to say that self-confidence can overcome lack of looks. No, no, no. On the approach, it does. On the approach, I still hold true to that. I've said that, Sacred Scout. I've said that your confidence and your ability to be forward is what matters the most on the initial approach in terms of generating an interaction that moment. That can override lack of looks, quote unquote. But I don't think it's true when if you're like on a date with if you meet up like for a date and then she decides not to meet up with you again. I don't think that that has to do with like um I do think that that's because of her not liking your looks. I mean, that's how it is. But the thing is, as a male, um, you can't get emotional about that. You have to have a backbone. Yeah, I was gonna end the live stream. I mean, I didn't end the live stream, right? I was gonna end the live stream. I'm like cracked the fuck out right now. I gotta end this live stream. All right, here we go. Let's try.